So, welcome back to our channel. My name is Monica, and I'm a women's health coach. And on this channel, we will discuss women's healthcare topics and holistic wellness. So, if you're interested in hearing more about polycystic ovarian syndrome and potential risk associated with the condition, please stick around. So, from our previous video, and you may want to take a look at that video before this one, we spoke about polycystic ovarian syndrome. We realized that it is a condition where there's an imbalance of reproductive hormones. So, and most women are diagnosed between the ages of 20 and 30. So, one of the risk factors is insulin resistance. So, this is likely related to various factors, including the presence of certain receptors that disrupt the proper use of insulin by the cells, especially in the presence of abdominal fat, which can worsen resistance. So, it's not that the body is not making insulin, there's definitely being insulin being produced, but the body just does not know how to process that. So women with PCOS are at risk for type 2 diabetes. And keep in mind that type 2 diabetes has been linked to cardiovascular disease and obesity. And approximately 65 to 70% of women with PCOS will have insulin resistance. And unfortunately, more than half of women with PCOS will be diagnosed with type 2 diabetes by the age of 40. So, women with PCOS are also at risk for abnormal cholesterol levels. So, what happens is that there is a lowering of good cholesterol, which we call HDLs. Those are your good ones. And an elevation of the bad cholesterols, which are your LDLs. So, with poor cholesterol levels, this can lead to cardiovascular disease, stroke, and other health issues. Another possible risk factor with PCOS is an overgrowth in the uterine lining. And basically, that's the inside of the uterus. Okay. So there's an overgrowth in the lining of the uterus. This overgrowth can lead to endometrial cancer. So women with PCOS, they may not ovulate, and they may have irregular periods to where they miss periods months at a time. So what happens is that the uterus is still being stimulated by estrogen with no counteraction because of the lack of ovulation. So what happens, that constant stimulation, because the woman's not ovulating, producing a hormone called progesterone. So progesterone actually causes the shed of the lining, okay? And that's the balance that we look for. That's why it's important for you to get your period monthly. So when there's not that shedding, there's continual growth. And we know too much of anything is not good. So what happens, that lining just continues to grow and grow and grow, and could eventually lead to cancer of the uterus. So we definitely want to make sure we're getting our periods. So another risk factor is non-alcoholic fatty liver disease. It is another potential risk factor for women with PCOS. So there may be some relationship between non-alcoholic fatty liver disease and insulin resistance, androgen excess. The androgens, if you remember from the first video, is basically male hormone. It's the male hormone, like testosterone. So what happens with polycystic ovarian syndrome, women are producing too much of that. We have it in our bodies at very small levels, but when there's too much, it throws off the whole system. So, the non alcoholic fatty liver disease could be related to that androgen excess as well as other factors. There's also a high prevalence of sleep apnea among women with polycystic ovarian syndrome. And this is possibly related to hormonal imbalances, androgen excess, as well and obesity. And we have to understand that with sleep apnea, it can lead to other health conditions such as heart attacks, strokes, and coronary artery disease. Next up is infertility. It is another risk factor due to the imbalance of reproductive hormones and the excess of androgens. Also, insulin resistance also plays a role in infertility because what happens because the body's not responding to the insulin being produced, there is an overproduction of insulin. So this overproduction in insulin further disrupts the hormonal balance. Another factor is the quality of life. So women with PCOS do have a higher risk of depression and anxiety than the general population, especially when facing issues such as finding a partner, desiring a family, fertility issues, and dealing with possible physical changes related to PCOS, like abnormal hair growth. So, if this sounds like you, I highly recommend seeing your healthcare professional.